Welcome to our live webcast, The Female Athlete. Thank you for joining us. My name is Eric, and I will be the operator for the presentation today. Before we get started, I would like to take a moment to acquaint you with a few features of this web event technology. On the right-hand side of your screen, you will see the text chat window. There is a large window which holds all of your sent messages, and a smaller text box at the bottom where you will type in your questions. To send a question, click in the text box and type your text. When finished, click the Send button. All questions that you submit are only seen by today's presenters. Your questions will be responded to in the order in which they were received and will be addressed at the end of the presentation. At the conclusion of today's program, we ask that you complete a brief post-event evaluation. Please take a moment to complete this survey in order to receive credit for providing feedback and attending today's webinar. We are joined today by our speaker, Dr. Anna Katsman, board-eligible pediatric orthopedic surgeon who practices at the Pediatric Orthopedic Center in Cedar Knollsand Springfield, New Jersey. At this time, I would like to turn the microphone over to our speaker, Dr. Katsman, for opening remarks.
Hello, thank you. So I'm Dr. Katsman from the Pediatric Orthopedic Center, and today we will be talking about pediatric female athletes and some of the unique challenges and injuries the athletes face as they go through their growth and maturation. We will also discuss nutrition, importance and benefits of resistance training, more common overuse injuries, and we'll cover hip injuries as well as ACL injuries. Over 3 million girls currently play in high school sports, but by about 14 years of age, there are twice as many female as male athletes that drop out of athletics. There are many reasons to explain this trend. According to Women's Sports Foundation, girls have about 1.3 million fewer opportunities to play in high school sports than boys. So girls have to look elsewhere, which may not exist, be easily available, or be cost prohibitive. Often, there is a decreased quality of experience. The facilities are not as good as the boys' venues, and the playing times may not be optimal. The availability of quality trained coaches may be lacking in their community, or the coaches may be more focused on the boys' programs that have more resources for training. Equipment and even uniforms aren't funded for many girls' programs at the same level as boys, so their ability to grow and enjoy the sport is diminished. However, through sports, girls learn important life skills such as teamwork, leadership, and confidence. Female athletes of all ages are healthier, more academically successful, and have higher self-esteem than non-athletes. In addition, young girls who participate in sports and regular physical activities exhibit enhanced motivation, improved mood, and lower levels of depression and anxiety. But despite these challenges, 40% of athletes in the NCAA are female. Female athletes are at an increased risk of injuries and are most vulnerable during periods of rapid growth. The first 2 decades of one's life are dominated by growth, maturation, and development. In order for us to better understand the physiology, let's first define these processes. During growth, there is an increase in the total size of the body as well as in all of the components individually. There is an increase in the bone, muscle, and fat masses. Organs increase in size as well. There are 2 main growth spurts that occur. Smaller one usually happens between 6 and 8 years of age, and around age 9 or 10, the rate of growth increases and the peak velocity is reached by age 12 in girls and about 14 in boys, and after which time the pace slows down. Around the same time, the weight begins to increase also, but unlike the height, increases in weight can continue well beyond skeletal maturity is achieved. It is important to remember that different parts of the body